We're live from our studios here in Kokomlemle on digital address GA0992539. Our lead stories this hour. Number of persons who have died from COVID-19 reaches 457 after 8 new deaths are reported by the Ghana Health Service as of 3rd February. Active cases now stand at 6,352. We check with our health facilities and some schools. Almost 4 days since a paramedic driving an ambulance was shot in an apparent robbery attack, police have yet to make any arrest. This afternoon, family of the slain EMT personnel are demanding an expedited investigation into his death. More as his female colleague who was sexually molested remains traumatized. Also coming up, Mr. Mahama, lawyers for President Akufo-Addo and Electoral Commission opt not to call witnesses to testify in the election petition, saying the NDC's John Mahama has not provided any evidence to merit a response. Mr. Mahama's lawyers, however, disagree and are urging the court to direct the witnesses, including the EC chairperson, to take the stand to be cross-examined. And the pulse is brought to you by Global Communities Dignilu, affordable, safe sanitation. Do join us on DSTV 421, GoTV 144. Remember, we're streaming live on YouTube and our other social media handles. Do send a WhatsApp on 0540109009. My name is Gifty Ando-Apia. This is the pulse. Please be my guest. You're welcome. Let's go through the details. The number of persons who have died after contracting the highly infectious COVID-19 disease has now reached 457 after 8 new deaths were recorded by the Ghana Health Service in its latest data capturing events on the 3rd of February 2021. There were 772 new cases on that day, sending the country's active cases to 6,352. There are more than 100 people who the service says are suffering severe COVID-19 symptoms. Meanwhile, at the Akonsomo International School, the number of COVID-19 cases has gone up by 37. That brings the total number of cases to 79, comprising 74 students and 5 members of staff. Here is Executive Director of the National Schools Inspectorate Authority, Dr. Hilda Ampedu, who disclosed this on the probe with MFA Apau last night.
COVID management team and all those who have tested positive are being taken care of by the Ghana Health Service.
79 cases, all students?
Students and staff.
Okay, well, but...
5 staff, the rest are students. So we have 74 students and 5 staff.
Okay, but what exactly, how is it being managed from what you gather?
So COVID-19 is a national problem. So there's a national team on the management of COVID. So the national team has taken over the case, and it's led by the Ghana Health Service, as we are very much aware of. So the regional health directorate is in charge in the region, together with the municipal health directorate. They are treating the positive cases. And I'm sure you've also heard that the school took it upon itself to test almost all the school's population. So far, 500 or so people have been tested at US. So of the 500 tested, 79 have tested positive. And Ghana Health Service is working very well with the school to manage the cases that are positive.
Hilda Ampedu there. So under which conditions can a school be shut down? What is the threshold of what are the protocols? Listen to the National Schools Inspectorate Authority.
Safety of our learners is key, and that's what we focus on. Now, in terms of threshold, like Alaji said, the coronavirus is a novelty. It's new. We are now learning a lot about it. So we don't have an exact number that says in a school population of 400, if 10 test positive, close down the school or something like that. We don't have those numbers yet. Currently, we work very closely with Ghana Health Service on advisory to do with the management of the disease. So what is advised is that if there are positive cases in the school, that you create an isolation center and isolate the learners in the school. Why is that advisory? Because if you let the learners go back to the community, they are going to spread the disease in the community. So currently, that is their directive, is to have the learners isolate in place at the school. But in terms of the exact numbers or the threshold where you reach and say, okay, this is it, let's close down the school, we haven't come up with an exact number yet. But that is not to say that if we, where I say we, ourselves, Ghana Health Service, etc., determine that a particular school needs to be closed down for further fumigation, sanitization processes, etc., because they are violating the protocols and they were not abiding, and it has put learners in harm's way, we will not hesitate to shut down such a school so that we can do what we need to do to ensure that learners are being safe in that school. So that's where we stand with that now.
Meanwhile, as public health experts emphasize the need to observe the safety protocols, JoyNews checks at various schools across the country reveal some schools have still yet to receive the government's PPEs. Let's now take you live to the Ashanti region, where my colleague Nanaya Jima has been visiting some schools in Kumasi to check with compliance. Hello, Nanaya. Nanaya, hopefully you hear me. Which schools have you visited so far? What is the picture there? Having issues with Nanaya Jima there. We'll get back to him shortly. But let's go to the Western region now, where our correspondent Inathalia Kwansa is joining me. Ina, we're learning of 2 cases at the Takoradi Technical University. Tell us more.
Yes, Gifty. So I also had the same information. I went to the school to speak to school authority, and they say that these 2 came to the school. That was somewhere last week when they had a workshop orientation, and these 2 were aware that they have been in contact with patients who were positive to the COVID-19 cases, and their samples were even taken. But because it was mandatory, they came to school, and then when they got back to the house, their test results came in and they were positive. So they immediately called their HODs, who also informed school authorities, and then they gave names of those they were in contact with whilst they were on campus. About 30 of them, they were all isolated, and their tests have been taken, awaiting their results.
How are authorities and the other students in the school taking this?
I didn't hear that.
I'm asking, how are authorities in the school and other students who perhaps may have come into contact with these people taking this?
Yes, so those who have come into contact have been asked to self-isolate, and then the authorities say they are building up their social distancing protocol and other protocols in the school. But on the other side, when you speak to some students of record, they are saying that they still feel that the school authorities have not done well when it comes to social distancing on campus.
Generally, what is the compliance level when it comes to schools? Generally.
Well, generally, the Western region right now, we have 542 active cases. As of yesterday, they did record 86 new cases, where the Secondary Takoradi Metropolis is leading, a worrying situation. We all know that the president said funerals and others are banned. But over the weekend, when you go to some parts of the SDMA, you could see a cross-section of the people having funeral section and others. I understand from the SDMA authority that from tomorrow there's going to be strict adherence, enforcement in the public with the police and other security agencies.
Regarding the town as a whole, I mean, we've talked about what's happening in the schools, but regarding the township as a whole, what can you report?
Well, Gifty, in Takoradi, people are still not adhering to the protocol, I must say, and authorities have also confirmed this, that residents are not adhering to the protocol. For face masks, you can see them wearing it. At least it has improved from last 2 weeks. But when it comes to washing of hands, provision of water at various shops, and then across various facilities, you do not see that. Social distancing, they are also not observing it here in Takoradi.
And what are authorities doing about this in terms of the general population's compliance?
Well, Gifty, they said tomorrow, since the case keep on increasing, and then the regional health directorate has also brought out the concern that if nothing is done immediately by authority, meaning the Western region's case will keep on increasing. And the last 2 weeks, the Western Regional Coordinating Council, which the regional minister is the leader, brought out a release that looking at how things are going, if the Western residents here do not comply, it is most likely that the region would be locked down. So I understand from a reliable source that tomorrow there will be military and police patrol in town to make sure that people are forced to comply with the social distancing and the washing of hands, together with those who are still not using the face masks.
Ina, thank you very much for that update. Natalia Konsa there. With what is happening in the Western region. Let's get to the Upper West region. Rafiq Salam is reporting that compliance is still low in public schools, with high compliance when it comes to the private schools. Rafiq, what more can you report? Hello, Rafiq? Rafiq, I think you are muted. Do unmute and I can hear you from there.
Hello, are you hearing me?
I do. Please go ahead.
I'm saying that the situation is no different from what Ina reported from the Takwari metropolis in the Upper West region, especially the one municipality. The level of compliance somehow has gone down. You know, some few days ago, the police went into town, arrested some people who were not wearing nose masks. And because of that, at least they were able to up the ante. But now, I can tell you that it's like the situation is going back to normal. People are really not complying to the social distancing. They are not wearing nose masks, and then the washing of hands is nothing to write about. When you move to the schools, as I reported in the morning, in terms of the public schools in the municipality, the level of compliance is very low. You go to some of the schools, the children are allowed to do whatever they like because they were playing football, they were playing games, and then also. It's only when they get into the classroom that you can see that there's some level of compliance to the face mask. But when you go to private schools, I visited Ansela, I visited Tender Preparatory School, it was different because they were compliant with the safety health protocols. The only challenge they are having has to do with the number of people, the number of pupils at their disposal, which is not easy to control. So generally, in the Upper West region, I can tell you that in terms of the public, the people are not complying to the safety health protocols.
Regarding the schools, Rafiq, the last time we spoke, you had a report in which the PPEs were just being received in the region. What has become of that? Have they been equitably shared across the schools? Can you report?
Yeah, they have been given these as PPE to the schools. But I can report to you that I have spoken to some of the students, some of the masters, and they told me off camera that what they have got is not enough. Some of the schools last week got 2 Veronica buckets for a whole class of schools. I can talk about 6, 7 schools, classrooms. So they are saying that it's not enough. And even in terms of the nose masks, they are not really enough for the students. So they expect parents to come to help government with some of these things. So government really has provided some of these things, but according to the masters here, they are saying that isn't enough.
You talk about compliance, which is still a big problem over there. And then you sent a report earlier about what the police intended to do. They were making some arrests. It looks like that hasn't really helped. Are health authorities there, in conjunction with the police, doing anything that you can report as far as getting people to comply?
Speaking to the Ghana Health Services Directorate, they are really deeply worried about the situation, the level of compliance in the region. And so, like they thought that what the police did was good, that at least some people were arrested, 83 people were arrested for non-compliance. They think that they expected the police to continue on that tangent. But it looked like it was only a 9-day wonder. After that exercise, we haven't seen much of the police doing that. And so, what the people expected, what right-thinking men of our society are expecting the police and then the Ghana Health Service to intensify their campaigns and also try to curb the whip and then try to arrest those people, people who are refusing to wear those masks and failing to comply with this safety protocol to be brought to book. That's what they expected. If not, the people here will not really comply to it.
On the top of this, do you have the figures for the region, Rafiq?
What I have was a couple of days ago, and I can tell you that Upper West region, 220 cases since COVID started last year were reported. Out of these 220, we've gotten about over 60, about 61 of them that are active cases. 65 are active cases, and then 61 are being attended to at homes, and then 4 of them are at the hospital. So that's the situation in the Upper West region.
Rafiq, thank you very much.
Eight people died.
8 people have died. Is there anything else? Yes. Is there anything else that we ought to know, Rafiq, from your side before we go?
Yeah, what we need to do is that the level of compliance for COVID-19 safety protocols in the Upper West region, I would tell you, it's nothing to write home about. People are still doing normal things. People are still doing weddings. People are still doing funerals. And then, and then they are doing the battle not up to 25. A huge sea of people, because see them at the cemeteries. And then even over the weekend, like somebody said, that you go to a funeral, you think that there's nothing like COVID. And so what the police or the security officers here need to up their game and then arrest people who are not complying to the order.
Rafiq, thank you very much for that update there. Rafiq Salam from the Upper West region, bringing us up to speed on what is happening there. I'll take you back to the Ashanti region, Kumasi to be precise. Nanaya Ojima, as I said earlier, has been visiting some schools. Nanaya, what can you report based on your findings?
So this morning, I went to some schools in the Ashanti region. I started with the Riverside Academy, a private school in the Ashanti region, and I observed that in that school there was compliance to the COVID-19 protocol. Students were mandated to wear the mask and have another in their bags. So compliance in that school was really high. That's the Riverside Academy in Kumasi here. I also moved to other schools in the Ashanti region, some public schools, and I realized that compliance, even though teachers are trying to enforce the compliance to the COVID-19 protocols, it is not as high as what I observed in the public school that I went earlier. So teachers are trying their best in the Ashanti region, but I think the students are finding it difficult to adhere to the protocols, especially the wearing of nose masks. Some of the kids that I spoke to told me that as they find it difficult to wear the mask throughout the day. So it's still a challenge in some of the basic schools in the Ashanti region, even though teachers are trying their best to ensure that all the protocols are well adhered to. But with the hand washing and the hand washing protocol, they are trying their best, and it has improved. But social distancing is still a challenge in most of these basic schools in the Ashanti region.
So what I'm getting from what you're reporting, Nanayao, is that it looks like there is better compliance in the private schools than there are in the public schools. Are health and education authorities there aware of this situation? Do you know?
So what I'm learning is that there's supposed to be a team going around ensuring that the schools adhere to these protocols, but I'm yet to hear about or learn about their report or whether they've been doing this activity that they've been mandated to do. But what I know is that government has supplied the hygiene materials to and other PPEs to all the schools in the Ashanti region, including the private schools. But according to some of the private schools, they didn't get enough, but they've still managed to put or solicit for some of these hygiene materials from the parents, and are able to ensure adherence to these protocols. But the Ghana Education Service is yet to take any is yet to take any measure on these public schools which are still struggling to ensure that these protocols are well adhered to.
Nanaya, thank you very much for that update there. Although I suppose, Nanaya, I hope I haven't lost you already, although I suppose that generally the compliance level in town has improved since the last time we spoke.
Somewhere last week, you could observe that a number of people were wearing the nose mask in town. But today, I'm realizing that people had let the gas down. It's not as high as what I reported last week. So it looks like people, even though somewhere last week, people were cautious and were adhering to the nose protocol. I'm going probably because the police haven't been enforcing these protocols, or they haven't been doing the job that they used to do before now. Okay. So it's not as high as we realized somewhere last week.
Nanaya, thank you very much. Well, meanwhile, Chairman of the Vice Chancellor's Ghana and Vice Chancellor of the UHAS, Professor John Japon, says there's a need for our school aggressive detection and testing mode in schools. Speaking on the probe last night, Professor Japon says the measures will stem the threat of further spread.
Managing the schools as they have been opened is to ensure that we have early detection mechanisms so that we can nip any potential outbreak in the bud. So the important thing for me is that the teachers and even the students should know what the key signs and symptoms are, so that once they begin to have any of such signs and symptoms, then they can alert their teachers or whoever is in charge, so that they can be tested as quickly as possible. And then they can be, if they are found to be positive, they can be taken out of that population into isolation so that they do not infect everybody else. So early detection and testing is very, very critical if we decide that we're going to keep the schools going. So testing, I mean, the PCR testing that we've been doing is very expensive, and I guess that is one of the main challenges. But in recent times, rapid tests have been approved by the FDA for us to be able to use antigen tests, which are cheaper. I mean, they are not very cheap, but it's cheaper than the PCR. So that if we could deploy all those things, then we are able to do the testing as quickly as possible and get them out of the population. Here at our university, we have sent out an alert that anybody who has any of those signs should make themselves available for testing. They can walk into any of the health facilities or even our testing center and get tested, so that we can put them in isolation and treat them accordingly. Another issue is that for those who test positive, we need to manage them properly, because there could be psychological issues in there. Some students could be the subject of mental challenges, and also some of their colleagues could be teasing them, and even accuse them of having brought the disease to the school and all that. So we need to have a way of managing those students and counseling them properly, so that even they who have become positive can become advocates and help in educating their colleagues in the various institutions.
MFR Pao there last night. Let's take a look at the situation in the Central Region, and I'm being joined via Zoom by Dr. Godfrey Sapong, who's the Deputy Regional Director of Health in charge of Public Health. Doc, thank you very much. Good afternoon.
Good afternoon,
Well, can you take us through the figures? I mean, how is it looking like for you in the region?
Thank you very much. Cumulatively, Well, our cases keep rising by the day. Cumulatively, we stand at 2,498 cases since we first recorded our first COVID case on the 8th of April 2020. And our active case count, it's currently at 241 cases.
241. And that's for what period? Is it for the since last year?
For the 2,498 since we first recorded our first COVID-19 case.
Okay, I mean that's relatively small. But given your case, you're saying that the numbers keep rising, and it seems steadily rising.
Yes. Since we started this year, specifically from January up to date, in January, early January, we were doing about less than 10 active cases. As we speak now, we are about 241 active cases.
That's an exponential growth. But what can you say about what you're recording in the schools? Are the schools contributing? Well, let me just say, how are the schools contributing to this figure, if there is any linkage here?
Well, in the region, we have done quite a couple of things, working together with the relevant stakeholders to ensure that we keep the school environment safe. We establish a task force. We have task force established at a regional and on our district, in the district levels, and it's a multi-stakeholder task force. The Ghana Health Service, the Ghana Education Service, NCCE, Information Service Department, and other relevant stakeholders who go around our schools, work with school management and the Ghana Education Service to ensure that the guidelines issued by the Ghana Education Service are adhered to. And we have done quite a number of things. We have school COVID teams that are working with staff and students in the various schools to ensure that COVID-19 safety protocols are observed. We have school infirmaries, and we've linked all our schools to our health facilities, hospitals and polyclinics. And so in a way that has really helped, I should say. Our numbers in SHS schools currently is, I think, about 8. We have 8 active cases since the schools opened. And we attribute this largely to some of the initiatives that we have launched. The task force, the school infirmaries that are functional, linking the schools to our health facilities so that if cases are suspected, they're quickly moved to our facilities for testing, sample collection and testing.
Let's dwell a little bit on your case management. What extent are people with, let's say, how many of the numbers that you have recorded are in critical condition? Or how many of them are asymptomatic, for example? Are these statistics available at this point?
Well, for the schools, no student is fortunately in any critical condition. Majority, almost all the 8 are either asymptomatic or mild. And that's good for us. We are not expecting anybody to have moderate to severe critical illness. But for the general, apart from SHS students, we have, I think, about 5 cases that are in moderate to critical, have moderate to critical illness in our treatment centers of the 241. So majority of them clearly are either symptomatic or mild.
And you indicated earlier on that you have 8 cases from the schools. Which means that all
Yes.
the others are from the region generally.
Are you referring to the 8 cases in SHS?
I'm trying to. So you've given us your number, which is a little over 200. I'm just trying to figure out how many of these cases were recorded in the schools and how many are from the general public.
So of the 241, 8 are in SHS students. So that's the number we have now. But we have we've suspected quite a number. We are awaiting the results. But as we speak now, we have 8 confirmed cases among SHS students of the 241.
Okay, how many of these schools? I mean, Cape Coast has a whole lot of schools. How many of these schools? Is it 1 school, 2? The 8 cases are in, I think, about six schools. What it means is that we're taking all these individuals and contact tracing those cases, correct?
Yes, that's what we're doing. So once we have a case in a school, what we do is that we contact school authorities and work with them to identify their contacts and take the samples for testing, and I get them isolated as well. And then we ensure that we are able to have systems in place to pick 6 students early and see if they meet our case definition for samples to be taken.
Are you able to share with us which schools these are? I mean, I'll understand if you are unable to at this point.
I can't mention the schools.
Very well. And I mean, we get this happening, but you see how the situation was managed at the Akonsombo Senior High School, International School, where eventually people got to know. And then in order to put information out there in good time to avoid parents from being hysterical and rushing to the school, which in itself could be a super spreader activity, people have advised that sometimes it's good to put out the information out there quickly.
I think that you've answered, you've helped me. You've helped me with the reason why I don't want to disclose the schools. We don't want some... don't want to create panic and for parents and guardians to rush to our schools.
Very well.
Suffice to say that all the students are well managed. They are being managed according to our guidelines and our protocols.
Okay.
And they are not in moderate. They are not with moderate or severe illness. They are mild.
Okay.
And they are doing quite well.
Okay. Let's talk about compliance. Does your heart ache when you go out based on what you see, or is it getting better because we've spoken about it quite a bit and the police, say they're doing things, they're doing something about it?
Yeah, I would say that compliance with COVID-19 safety protocols has improved, but we would wish that the levels we're seeing, the levels of compliance we're seeing, are much better than you still come across quite significant sections of the population who are either wearing their face mask wrongly or they are not in their face masks at all. But I should say that since our president announced that we should ensure that we enforce and comply with the COVID protocols mid-January, it's improved.
Okay.
Now you see, it was a situation that you go to the public spaces, and it was no mask at all. Now you count 10 people. If you count 10 people, 1, 2 are probably wearing the face mask and are wearing it right.
Okay.
And so, yes, we started, and we're seeing, I think the police are also helping enforce compliance. And we're seeing their presence in our public spaces, to walking around, moving around, engaging with persons, to ensure that we all comply with the safety protocols.
let's wrap up our conversation with this sensitization program. Is that something you're embarking on? Give us a little bit of an insight.
Yes, in all our districts across the region, we have risk communication teams that are engaging with various stakeholders, going to fishing communities, market areas, drivers, religious bodies, and working with them to understand why we have to collectively comply with COVID-19 safety protocols. And so that task force is all in our districts, and they're working, and they're contributing significantly to the compliance that we're seeing with, at least the little compliance we're seeing with COVID-19 safety protocols. But it's quite difficult in some areas of our region, particularly along the fishing communities. That still believes that this whole thing is not real. It doesn't exist, and even if it exists, it's not as serious as we are saying.
Well, I hope that it works, and Doc, I hope that those who are the tracing that you're doing from the 8, at least from the schools, will give us some results to smile about. Doc, thank you very much. And that's
thank you so much.
That's Dr. Godfrey Sapon, Deputy Regional Director of Health, in charge of public health for the Central Region there. 8 cases, we understand, from our schools, but they are tracing and they are managing it over there. The Northeast region has recorded 32 COVID-19 cases and 4 people have been killed. The cases were recorded from 4 out of the 6 districts of the region, with 2 of the victims dying before their sample results were confirmed. Regional Director of the Ghana Health Service, Dr. Abdullahi Abukari, confirming to JoyNews, said the victims included an 80-year-old man from Binde who tested positive after he was referred to the Nalerugu Baptist Medical Center for stroke. He was diagnosed with stroke. Elias Tanko reports.
According to the director, about 107 contacts are being traced, with all except 1 patient being managed at home.
So currently, as we sit, I think as a region, we have so far recorded 32 cases. And there are 2 districts that we have not so far recorded any case. And these districts are the Bunkrugu Nakwanduru district and the New Naswan district. But let me indicate, we had some cases which were referred from Bunkrugu Nakwanduru district, and then later on turned out to be positive in East Mamprusi district. I mean the hospital there, the Baptist Medical Center. But in general, the breakdown for the 32 cases, we have Cherpune district recorded 9 cases. Mamprugu Madure district recorded 1. East Mamprusi municipal recorded a total of 12 cases, out of which we lost 2. And West Mamprusi also recorded a total of 10, out of which we lost 2. So that brings our total to 32 cases. We've lost 4. But of course, as and when the results come, we'll review the cases and see, and then this figure might change.
Dr. Abdullahi used the opportunity to urge residents of the region to abide by the preventive measures and obey the directives by the president to stop the spread of the virus.
So my message to the general public is that please, let's abide by the preventive measures. Let's take it up seriously, and let's try to put in practice whatever the president is advising us. So the funerals, and then the outdoors, and then the weddings, people now need to understand that we have to make sure that we limit the number.
Meanwhile, JoyNews observed many people are still disregarding the safety protocols by refusing to wear masks and practice social distancing. It is a market day in the regional capital, Nalerugu, and all is business as usual in the market, with majority of the patrons not wearing masks, and not a single Veronica bucket was spotted for the practice of hand washing. When asked why they weren't wearing face masks and breaching other safety protocols, some of them responded because they do not believe coronavirus is there. Where was the coronavirus when Nana and John Mahama was campaigning on the streets? For me, I do not believe coronavirus is there. Whether or not coronavirus is there, those destined to die from it will die. But for us as poor people, we believe God will not burden us further with this sickness. So we believe we are immune. All the good things that happen in this country stay in Accra. So we believe by God willing, the virus will stay with those enjoying in Accra. Elias Sutanko reporting for JoyNews.
Obviously, a lot more work to be done. But as COVID-19 cases increase sharply in the Northeast region, institutions mandated to carry out public education campaigns on the virus are unable to do so because of lack of logistics and inadequate personnel. The Information Service Department and the National Commission for Civic Education in the region do not have vehicles and staff to be able to conduct COVID-19 sensitization exercises in communities and public places. Here's another report by Elias Sutanko.
While the MCCE has been forced to reduce its COVID-19 education campaigns to random street engagement only in the regional capital, the Information Service Department is virtually on its knees with no vehicles and offices to operate. This is the Information Service Department office in the Eastman Proceedings municipality. Inside the office, it appears so unkempt and abandoned, with old office chairs, tables, and damaged cables hanging from all corners. The building is said to be facing years of neglect without a single renovation. On our visit, we met a fairly elderly female staff who refused to disclose her identity because she wasn't authorized to speak to the press. But she agreed to allow us film the facility and even requested for an off-record conversation. According to her, the department was yet to receive any direct COVID-19 support from government, and that staff here used their old motorbikes and other resources to conduct official functions without any reimbursement. Similar situation was observed when JoyNews visited office of the National Commission for Civic Education. Regional Director of the Commission, Wilberforce Zangina, speaking to JoyNews, noted the challenges of infrastructure, logistics, and personnel were affecting the fight against COVID-19 in the region.
We have challenge of means of transport. Looking at the terrain, you need very robust vehicles so that at least you can crisscross the entire region. As I speak with you this afternoon, we have only 3 vehicles in the region. 2 are serviceable, 1 is not. But the headquarters is aware.
The region has recorded over 30 cases with 4 deaths in the last 2 weeks. With over 107 samples under laboratory tests, health officials have anticipated a rise in the figure. Yet many residents across the region still lack knowledge about the virus, while others insist they are immune. They are telling us lies. They are deceiving us. Where is the virus? The virus is not here. The virus cannot get here. These misconceptions and entrenched position towards the virus, according to the NCCE director, is worrying, and thus call on government to retool the commission to ensure effective public sensitization to curb the spread of the virus.
You can even look at the office. You can see this office was established a year ago, and should I even say we are even patching? It's not an office, because this is a municipal office, and the regional offices we are patching. So definitely it has to affect the output. If you don't have enough personnel motivated, no means of transport, logistics, computers, and all those things, if you don't have them, definitely you can't perform as expected.
Ilyasu Tanko reporting for JoyNews.
You're still watching The Pulse with me, Gifty and up here. Like I said, a lot of work to be done, but the NCCE, unfortunately, doesn't seem to have the capacity, especially, or at least in the region from where Ilyasu Tanko brought you that report. Let's take a quick break. When we return, we go to the Bono region in the Wenchi municipality again. Do stay with us. You're welcome back. In the Bono region, the Wenchi Municipal Director of Health, Robert Kwesibio, has attributed the number of COVID-19 positive cases recorded in 2020 to enhanced surveillance. According to him, the enhanced surveillance showed that there were many carriers of the virus, but they're not showing symptoms. Robert Bio spoke to JoyNews' Nesta Kafui Ajoma in the region.
Robert Kwesibio said health officials told him COVID-19 was not present in the Wenchi municipality when he started work as the Wenchi Municipal Health Director in May 2020. He, however, led the municipal COVID-19 management team to begin enhanced surveillance. According to the Wenchi Municipal Health Director, an initial 19 confirmed positive cases of COVID-19 were recorded in 2020, but later went up during the year.
Initially, we took samples of 700 plus. And then the first results started trickling in on 3rd July. By the end of 2020, we had recorded 189 COVID-19 cases, 188 recovered, and there was one person who died. And the person who died had a lot of complications. This person was hypertensive, diabetic, and also had hepatitis. So 3 conditions. The person had diabetes, hypertension, and then hepatitis. So we could just imagine such a person exposing himself to COVID-19. You know what will be the end result of it. But when we talk about 2021, as at now, we've suspected 8 people. We've sent their samples, and 2, we've had results of 5, 2 positive, and then 3 negative.
Robert Kwesibio stated his team was challenged with the late receipt of COVID-19 test results during the year 2020.
Initially, the biggest challenge we faced was the results coming in and for us being able to take action. The first cases we took, it was over, 6 weeks. So we were in a fix. Actually, by God's grace, for 2021, CHAC has deployed PCR machine to a Methodist hospital.
Well, the COVID-19 response team at the Greater Accra Region Hospital has indicated that work is complete on an in-house testing facility for the virus. A member of the team, Dr. Emmanuel Adipo, says the general increase in positive cases and resultant test delays the delivery of results from the Noguchi Memorial Institute for Medical Research, Ghana's leading test laboratory. He says it is necessary for the hospital to procure their own resources for testing as part of their treatment process. Listen to him speaking to Daniel Dazi on Prime Morning.
With the arrangement we had with Noguchi, we had about 48 hours, an initial arrangement of 48 hours. But when the numbers started increasing, it sometimes took a week. So what we have done now is to procure through the Ghana Health Service and the Ministry of Health, procure the gene expert machine to run the PCR ourselves because we are the Greater Accra Regional Hospital, and there's no way we should, not be able to do in-house testing ourselves. Gladly, I'll say Noguchi has also given us the hint through Prof. Ampofo that they are going to supply about 700 pieces of antigen tests to start a pilot project of running antigen tests in the Greater Accra Regional Hospital.
Interesting.
So, yes, so that is the progress we are making in terms of diagnosis and treatment.
How soon are you expecting to get these antigen tests?
In fact, as of yesterday, the director of the hospital had mobilized the artisanal team to renovate parts of the, the TB testing center, the TB laboratory. And so an extension has been made where people can comfortably sit and the sampling will start. And so I'm sure today we are going to start the piloting of the testing at the Greater Accra Regional Hospital.
And Director of the West Africa Center for Cell Biology and Infectious Pathogens, Professor Gordon Awandere, has lauded the move, but he's calling for more tests in public health facilities as well as our schools.
The most important thing that he has said is the deployment of the antigen test. That would be really, really, really important because the rapid antigen test would allow you to quickly identify people who are actively shedding virus because, this, even though it's not as sensitive as PCR, if people are actively shedding virus, they would show up positive on the antigen test, the rapid antigen test. And so that will allow you to quickly identify people who show up either at the OPD or the emergency with symptoms that are consistent with COVID. They could be just non-respiratory. They could just be malaria-like symptoms, which are not necessarily respiratory in nature.
What about capacity, Prof? We are currently reporting about between 600 and 700. The last number of new cases that we had positive was more than 700 on the 3rd of February. That means that we are getting a lot more positive cases, a lot more tests need to be done. They are receiving 700 antigen tests as a token of sorts from Noguchi. How sustainable is this?
Yes, if they are getting only 700 tests, that would not do much. That would just be to try it out. We need millions and millions of these tests. And I think, the government should be arranging to bring a lot of these. I also suggested that this should be used in the schools as well for random testing of students so that you identify, students who are carrying it asymptomatically and who may spread it. So really, this move to approve some antigen tests is very crucial at this stage of the pandemic. But we now need to make them more rapidly available. We need to, import a lot of these tests and make them, freely available to the major hospitals and primary healthcare facilities.
Well, away from there, residents of Sokode traditional area in the whole municipality of the Volta region have been lamenting the lack of water supply. The residents say they are compelled to rely on water from streams, dams and wells for domestic use. According to them, the development impedes their quest to abide by the COVID-19 preventive measures of frequent hand washing and the clean running water. The Assembly member for Sokode, Mark Billions Bansa Dixon, is therefore appealing to government and management of the Ghana Water Company to rectify the problem in earnest.
The Sokode traditional area in the whole municipality comprises 5 divisions which harbors about 40,000 residents. Though they are connected to the national water grid, their taps hardly flow. The peri-urban area has been bearing the brunt of lack of water supply from the Ghana Water Company for over 5 months. This has compelled them to rely on wells, dams and other water bodies for domestic use.
We have
been enduring the lack of water supply for the past 5 months. Our children are suffering. We only get water when it rains. We are being educated to frequently wash our hands, but where do we get water to wash our hands? We are pleading with the government to ensure Sokode is supplied with water frequently. The development is affecting the academic activities of students who spend hours at the roadside fetching water. It also puts their lives at risk as children as young as 7 years old engage in fetching water from these wells, which are over 40 feet deep.
Sometimes we need water to bath to our school, so because of the availability, it's not available. We have to get late to the school.
If one at 4, I'm a phone at 3.
We previously fetched water at dawn, but the law has been changed because they say children are going to the well side. They now open the well at 6 a.m. and close it at 6 p.m. This is affecting those who engage in economic activities outside the community. The well is mostly closed before we get back home. The residents are marveled by the inability of the Ghana Water Company to rectify the problem and supply their communities with potable water. They fear continued reliance on these water bodies might affect their well-being if the government continues to look on unconcerned. Taps in Sokode have stopped flowing for about 5 months now. We are pleading with President Akufo-Addo to help resolve our water challenges so we can get water to fetch and wash our hands. The assembly member for the Sokode-Gbogame electoral area, Mark Billions Bansa Dixon, indicated that several attempts to engage the authorities to resolve the challenge proved futile. He explained that the Ghana Water Company failed to honor its promises of providing tanker services and rationing water supply to the area.
Because there's this pump at Peve that serves the entire municipality, as in whole municipality. But I learned from 1993, since the pump was commissioned, the pump has never received a facelift. So 28 years down the lane, it is the same old pump that is serving the municipality. But you bear with me that 28 years ago, the demographics within whole municipality is not compared, cannot be compared to the very demographics we have in 2021. So it means population size has increased, there's pressure on the pump. So we are appealing to central government to come to our aid. You know, the pump should get a facelift. If it means it needs to be changed, they can change it. And what I also learned is that the manifold or the setup at Peve is not as good as the setup at Pong. And that is also causing the water issues, because I learned the flow when they pump and it needs to flow through the manifold. There's a challenge for the flow of water at that very place too. And we are appealing to central government, like I said earlier, to come to our aid so we can have water running through our taps.
The residents are, however, hoping the authorities would listen to their plea and come to their aid within the shortest possible time. Fred Kwame Asari, Joy News, Sokode.
Now, away from that, family of the slain ambulance service worker who was shot by suspected armed robbers while on official duty is calling for expedited investigation into the incident that led to his death. Abraham Tete was attacked and shot more than 6 times by the robbers on the dawn of last Thursday while he was transporting a pregnant woman from the Akuse Government Hospital to the Eastern Regional Hospital in Koforidua. He was rushed to the Kolebu Teaching Hospital where he died on Saturday. But 4 days on, the police is yet to arrest anyone in connection to the incident. JoyNews' Manuel Kranting was at Chopoli to speak to his family, who want the perpetrators to be brought to book immediately.
Sorrowful scenes that welcomed us to the family house of late Sergeant Abraham Tete at Chopoli. Friends and sympathizers from far and near had come to commiserate with the grieving family. For many who had heard the news, it was the death of Abraham, the EMT personnel. But for the family, it is the loss of a pillar. He would never turn down a request for assistance from any family member. He really was our backbone. I am a man and I shouldn't be crying, but Abraham meant so much to me. It's only God who knows what happened. But Abraham's life's journey was not without a struggle. His 70-year-old mother, Awunye, tells me of how she sold her belongings and did all sorts of menial jobs to see her son through school.
I used to hawk biscuits with his grandmother at Accra, just to get something to take care of his educational expenses. He would even sometimes join us to pick firewood and sell, all just to put him through school.
AB, as he was affectionately called, was truly drawn to his family. His 90-year-old grandmother revealed how he transferred from the Tamale to Somanya station of the ambulance service just to be close enough to take care of her.
Tamale, first yata, no ani yata ne keje bia maeke, enajimi imbehiwa.
He was earlier stationed at Tamale, but applied to transfer to Somanya.
She dreads the reality that Abraham has taken an early flight to the way of all men.
Nkete dokita ni nye dani egbo e la kai kete ni nye na egbo se ali finele.
While he was alive, there was hardly any dull moment around him.
He was a very humble man. He always creates some fun at our family gatherings because he could sing and dance very well.
For the support system that he was, Abraham's family will have nothing short of an expedited investigation leading to the arrest and prosecution of his killers.
The information we are gathering now indicate that the whole thing started somewhere 11 p.m. and Abraham was shot somewhere 2-something to 3. Even when, according to source, Abraham was second car. That means the armed robbers. And it took them about 2 hours to kill my cousin. We want the police administration to investigate it very wide. We are not taking anything out. Right from the working place to everywhere, they should at least investigate it very well. And these perpetrators of this heinous crime should be brought to book.
For Emmanuel A. Tete, who is spokesperson for their family, they want government, and for that matter, the police service, to expedite investigations and bring the perpetrators to book. From the family house of Abraham Tete, the slain EMT official of the National Ambulance Service, here at Chopoli. My name is Manuel Cranting for JoyNews.
It's been 4 days and counting, and hopefully we'll hear from the Eastern Region Police Force and also from the police force nationally. But the Chief Executive Officer of the National Ambulance Service, Professor Ahmed Zakaria, says armed robbers who shot and killed the ambulance driver did not only rob a pregnant woman in labor, but also sexually assaulted a paramedic who was with the team. He says the morale of the National Ambulance Service has been dampened by the horrific incident.
Honestly speaking, we are all at a loss. And up to now, we've not recovered. Because nobody will have thought that an ambulance carrying a sick patient will be attacked. One will have assumed that maybe they mistook it maybe for a police vehicle. But for the armed robbers to get close, identify it as an ambulance, shoot the driver, and still shoot the vehicle, force the patient compartment open, see a patient lying on a stretcher, being attended to by a paramedic, and still go ahead to rob them and handle them is something that definitely we are yet to come to terms with. We never will have believed that such a thing can happen. Initially, people were trying to rationalize that perhaps they mistook the vehicle as a police vehicle, but a subsequent event showed that that wasn't the case, because they really got closer, they saw it was an ambulance. And after they shot the driver, who was himself a paramedic anyway, they still forced themselves into the patient compartment. And after everything, they forced the poor lady to go and switch off the engine because they felt that the siren and the beacon light was drawing attention. So obviously, it's something that we have to condemn in no uncertain terms.
Actually forced one of the workers to go and put off.
Absolutely. So what happened was that after they shot the vehicle, the driver definitely was injured, so he could not move. So now the patient, the paramedic, they were in the patient compartment, and normally it's locked. So they had to force it open, shoot the vehicle, force it open, enter the vehicle, rob the poor girl of her telephone with whatever was on her, fondle her breast, force her into the driver compartment to switch the engine off so that the beacon light will be off so that it will not draw attention. Obviously, it was really tragic and very pathetic. And it's not something we can even rationalize and say that perhaps they thought it was a police vehicle.
There's even an element of sexual assault, there.
Definitely. So the lady is really traumatized.
Who did they assault? Is it
the paramedic? There were two of them. The driver, who is a male, and the female who was in the patient compartment attending to the patient. As for the driver, he was shot in the eye and in the head. So obviously, he definitely will have lost consciousness. And so with the head on the steering wheel, with his seat belt still on, definitely he could not move at all. So now they had to force the poor girl to leave the patient compartment to go and switch the engine off. All this time with a gun pointed at her head. Obviously something that is very traumatic, that it will be very difficult for the lady to recover immediately, unless with some psychological support.
So it was in a compartment that they fondled her breast? Or?
Absolutely. Wow. When they brought her out, absolutely, you understand. And so if she narrates her story to you, it's really something that is very pathetic.
How is the family of this emergency medical technician taking this news?
Not only the family, the service, everybody is devastated. Because imagine you leave your family, you're going to save people's life, and you don't return. And not that maybe you had your car crash into another vehicle, but you were shot by armed robbers.
He says plans are advanced to increase the risk allowances of members of the service.
The paramedics are really demoralized now. We are encouraging them using this media to assure them that everything is being done to make sure their concerns are addressed. And then their conditions of service definitely will improve. And then we also look at options, taking advantage of this misfortune to see how some of the outstanding issues could be addressed, i.e. the risk allowance issues and then the life insurance issues. Those are issues that cannot be decided immediately, but with a lot of...
Are they calling for more allowances and more insurance?
No, definitely when such things happen, there will be agitations. So we're taking the opportunity to assure them that their services are being recognized by everybody, And if you look at the social media reactions, everybody is in solidarity with them. That shows that the Ghanaians appreciate whatever is being done. And with that, definitely the political will will be immediately available to address some of the challenges that they are complaining about.
Police in the Upper East region say they have extended an invitation to tomato sellers, traders, to enable them discuss security measures for the traders as they travel between Ghana and Burkina Faso to purchase tomatoes. This comes after 2 trucks carrying tomatoes and cement were attacked by robbers last week and the drivers killed. Upper East Regional Police PRO ASP David Frank Otri tells JoyNews' correspondent Albert Sori that a police patrol team assigned to the Poalugu stretch of the Bolgatanga-Tamale Road where the attack took place were at another location when they received a call about the incident. He says by the time the patrol team arrived at the scene, the robbers had fled. Albert Sori is joining me right now via Zoom to tell us more. Hello, Albert.
Hello, Gifty.
Albert, what more can you report?
Yeah, so this incident happened last week, and the police have been investigating since then. One of the things we know from what the police told us was that these people who were attacked were traveling from Kumasi to Burkina Faso when they were accosted and attacked by these robbers. Now, 3 days before that, there were some tomato traders in Kumasi who had been speaking to Prince Apia and other journalists in Kumasi about the fact that normally they are being attacked when they are traveling to Burkina Faso to bring in tomato, and they wanted protection from the police. And so it wasn't it was too surprising for many people that just 3 days after they made this call on the Ghana Police Service, 2 of their members, in fact, one of them, was attacked. And then there was another driver who was carrying cement who was also attacked. We are told that there were some passengers in the 2 vehicles whose valuable items like mobile phones and monies were also taken from them as well. And so many people in our region were agitated when some of the members of the Tomato Traders Association gathered at the hospital where the bodies of these victims were being kept. We're talking to media and calling on the police to wake up and to protect the citizens of the region. It was this that I put to the police PRO this morning, and he said that it's not as if they haven't been patrolling the area, and that they have a patrol team which mans the Bolga-Tamale Road, and the stretch where the attack took place was within the police command of the Talensi district, but the patrol team had been on another stretch of the road when the attack took place and they were called. So by the time they got there, the robbers had finished what they were doing and ran away.
And had left.
So
Albert, let's listen to the police officer that you spoke to, and then we'll continue with the rest of the story.
It's a responsibility of the regional police command to ensure each and every person within the region is protected. And for that matter, that is exactly what we've been doing for the past. This recent robbery that took place on the Boga Tamale Highway, it has come to us as a surprise. Just because we have enough measures put in place on that road, and not just on that road, all the major highways that leading to the Upper East region, we have security arrangements on those roads. Boga Tamale Road, we have one. Boga Paga, we have. And Boga Boko, we also have similar arrangements, because we know that they are all international roads and it passes through our jurisdiction, and for that matter we should ensure that the road is safe safer for all who commit through those roads.
The suspects, anything on them at all?
The suspects, you know, I told you that when we got there, they had flee, but intelligence have been put in place, and we are making efforts to arrest these perpetrators. The good thing is that their modus operandi is being taken care of. As what they do is that they fire indiscriminately into this vehicle, according to survivors of this. That is a good piece of information to us.
Were there monies or any other valuable items taken from them during the?
Yes, some in the articulated track. I think their mobile phones were taken from them.
Albert, sorry, they're speaking to the police PRO for the area. Meanwhile, authorities in Wale Wale in the Northeast region are calling on members of the Ghana Tomato Traders and Transporters Association to call off their strike, which started over the weekend following rampant robbery attacks on the Tamale-Bolga Highway, as you've heard. Chairman of the West Mampresi Municipal Security Council, Arimiya Somolaki, who made this appeal, said there is enough security personnel following the deployment of reinforcement and of personnel and vehicles by the IGP in the area.
For the past 2 weeks, there's some relative calm in terms of armed robbery so far as West Mampresi municipality is concerned. This came as a result of a lot of efforts by government and the municipal assembly to see to it that we fight this social canker. We are happy that the Minister of Interior and the IGP has responded positively to our call by deploying more men to the West Mampresi Municipal Assembly. So far, about 29 police officers have been deployed with 4 vehicles for patrols. And then our local police also have 2 vehicles, and now patrolling in the municipality is now something that everybody is happy with. The same road, talking of Saviligu, Bolga, and other municipalities closer to West Mampresi should also up their security, because when the tomato sellers goes to Navrongo to buy tomatoes, they pass through these roads up to. But for my area, I can assure them that from Nasia to Karminga, it's safe for driving in the night and safe for driving during the day.
Well, is it for you? Some bus drivers who have been speaking to JoyNews say they now fear plying the highways, especially at night, because of the numerous reports of armed robberies. Data from the Ghana Police Service indicates robbery, including highway robbery, is on the rise. Last week, armed robbers attacked a truck driver on the Bolgatanga-Tamale Highway as he headed from Kumasi to Burkina Faso with passengers to purchase tomatoes. Another driver on a trailer truck loaded with bags of cement was also shot at. Both died. The robbers who also robbed the passengers and inflicted wounds on some of them. Take a listen to these drivers who say the incidents have made them afraid.
It is happening. It's truly happening. Because normally the customers, if they were coming from their various home or town, coming to the markets, armed robbers will be attacking them. I'm scared. We are feared. And if it happens like that, if you call police too, it keeps long before police will come and help you. And whatever they want to do, they do it before police come.
It is real. You know, I normally left my hometown, Joje, around 2 to 3 o'clock in the morning to Accra. There was a time this thing happened, we all stop on the road. When I get into Botama, we all park over there. And we were expecting the police to come up. You know, those vehicles coming from Accra also park. So we are at the middle. One of our colleague driver called Mustafa was shot. So anytime we take off from our hometown, normally fear. We used to be afraid to the extent that at times for me, when I leave Georgia, I come and stop at Tajavu for another vehicle to come and join me so that we move together.
As a driver, sometimes you load your passengers making a journey, and you reach a point whereby they will tell you that, or you see some cars signaling to you that there's some armed robbers on the road. So you have to sometimes you have to park the car and wait until they get off the road, or sometimes unexpectedly you go then enter into them. Then they'll rob the passengers, even you the drivers. If sometimes you'll be working for sometimes, and the money that you'll be working throughout the week, it is with you. They take all the money away from you. It disturbs us. It's not only one particular way, or no, they haven't stationed at one particular place. They have been roaming about. So any place they can stop and then rob.
It affects us a lot. Simple because when you heard on the road that the armed robbers are on the way, you can't drive anymore. You have to park somewhere for the meantime, or to call the police to assist you so that you can pass by. Sure, we are scared. We are scared. Not me alone. All the drivers that drive on the highways. Anytime I thought that we hear that the robbers are around, we are scared.
And you're still watching The Pulse with me, Gifty and Drop here. Before we take a break for sports, lead counsel for John Dramani Mahama, Tatuchi Kata, has accused the Electoral Commission chairperson, Jean Mensah, of evading cross-examination. This was after the lawyers for the EC and President Akufo-Addo had indicated that they do not intend to open their defense or call witnesses. The submission by the counsels for the first and second respondent follows the cross-examination of 3 witnesses testifying on behalf of the 2020 NDC presidential candidate. Mr. Mahama had filed witness statements for the NDC's General Secretary Johnson Asiedu Nketia, Dr. Kpesa White, and Rojo Metonunu. These individuals were subsequently cross-examined by lawyers for President Akufo-Addo and the Electoral Commission. Following the discharge of Rojo Metonunu, lawyer Tatuchi Kata informed the court that the petitioner had closed his case. But in an interesting twist, the lawyers for the respondent, who had already indicated that they will call 1 witness each, told the court they had rescinded that decision. The 2 counsels argued that the evidence presented by the witnesses for the petitioner and from cross-examination do not support the reliefs being requested by Mr. Mahama in the petition filed. Citing Order 36, Rule 4.3 and CI 87, Rule 3E5, lead counsel for the EC, Justin Amenuvo, told the 7-member panel of the judges that the EC was satisfied with the proceedings so far and asked the court to make a determination on the petition before it. This video is on demand on YouTube, and also there is more of that information on myjoyonline.com. Right now, let's do some sports. Gary L. Smith has it all.
Thank you for staying with us on The Pulse. Gifty will be back to wrap up on the show in a bit. But for now, in the sports, the Ghana Football Association have closed down the Chumesi Sports Complex located in Nswatre indefinitely after Sunday's uncouth behavior of home fans during a Division 1 League match. Fans of the team that are residents in the town in Swatreman FC are reported to have pelted the away side, Real Tamale United as RTU, after the final whistle. Players and officials bled profusely and have sustained various degrees of injuries. Say Mubarak is the communications director at RTU, and he joins us for an update. Say, thank you very much for your time.
It's a pleasure, Gary.
Yes, so we saw the pictures after the game. Bloody doesn't begin to cover it. Can you give us an idea? And we are seeing a bit of it and that we can show on television.
Well, I think that it was one of the darkest days, especially that we are trying our best to bring back the law. I'm talking about the tag from the Ghana Football Association. This was just a very unfortunate incident that happened yesterday, and it all started before the game. Some fans came with the notion that they wouldn't allow any other team to come and win at the ground. And so they were going to start or use RTU as a starting point to win all home matches that are left. And so it was very, very clear from the utterances and the comments from the supporters that if this game ends either in a barring or RTU should walk away with a 3 maximum points, things wouldn't be same. And so I wasn't surprised, especially after we arrived there and the scenes that I saw there. I just knew that if this game was going to end in a draw or a win for RTU, these things were going to happen. So honestly speaking, it was barbaric. This should be condemned under any circumstance. because it definitely is not going to help the course of the development of the game. Right after the referee had whistled for the end of the game, about 6 supporters were able to find themselves inside the inner perimeter with stones and sticks. Now, the police was able to deal with that situation, but after the team had failed in their first attempt to get into the tunnel, to get into the dressing room, they had to remain on the pitch, and that was where all these things started from.
Right.
Of course, one of our management members, Alhaji Abibu, you can see got, badly hurt from the nose because there was a big stone that was thrown outside the pitch into the, where the players were.
So what's the count? How many were injured?
Well, seriously, those who were injured were 2. The guy who got our equalizer, Abubakar Nawaz, you can see, and then the management member, Alhaji Habib. Of course, there were other players, assistant coach Kojo White, who also had a feel of the stone throwing, but their situation wasn't too serious. The technical medical team of the club managed to actually work on them before we left the shores of Nswatri.
This should not be happening. I mean, Nswatri have now officially got a message from the Ghana Football Association, who in a statement, and I'm reading from them, say they have received reports of assault on players and officials of Real Tamale United who have sustained various degrees of injuries. Now, the statement goes on to say that this unfortunate and unacceptable incident took place after their matchday 6 Division 1 Zone 1 game played between Nswatri Man FC and Real Tamale United FC on Sunday, February 7th at the Kumasi Sports Complex in the Bono region. The leadership of the GFA is appalled and shocked at the behavior of the home fans, and the GFA condemns unconditionally the non-football behavior and conduct of fans of the home team. The Executive Council of the GFA has therefore decided to ban the venue indefinitely as the association continued to cooperate with the police to bring the perpetrators of this barbaric act to book. The statement we've heard say, are you satisfied with the initial action from the GFA?
Well, I think that was quite quick. Right after the game and when these incidents were happening, we managed to get footages and pictures of this, and then we kept them on some of the platforms we know will go straight to the Ghana Football Association. Well, the first thing they did was to call their away team, that is Real Tamale United, to check on them and whether they have been able to get out of the town. In fact, we did confirm to them that we are on the way to Techiman. Prosper Harrisonado, who is the General Secretary, actually condemned the act. He stood on behalf of the Ghana Football Association to indicate that they were going to work on this, but we never expected that it would come so soon. Before we go to Techiman, we had received reports of this ban. I think that it is the right thing that the FA have taken, because honestly speaking, I'm just about leaving here to the training camp because the fans of RTU since yesterday have been very, very angry about this situation, and we are aware that Nswatri is coming to Tamale on Sunday to play BYFC. Already, fans of the club are preparing to attack them. We want to meet them and show them the statement from the FA. We do not want such things to happen in our game. We have condemned it, and we do not want Real Tamale United to suffer fate. So we are meeting them, but in honestly speaking, I think that I am very, very happy the statement has come out. This definitely will serve as a deterrent to other clubs that have similar agenda in relation to beating fans and players or officials of our team.
Thank you. Say, we appreciate your time and your patience and your candor in this matter.
It is a pleasure.
Right. So say Mubarak speaks for RTU. And like you said, very, very swift. I mean, we are not used to the GFA acting this swiftly when it comes to matters like this. And so definitely a feather in their cap. We'll be following this story, and you can get more on myjoyonline.com as and when it develops. That's the sport for now. I'm Gary Al Smith. The news continues.
And this is where we leave you with Let's Talk Showbiz, which is how we wrap up the entire show. Like I said, it's a full package. We've got the news stories, the sports, and of course, the entertainment. But the video is on demand on our YouTube page. I'll urge you to take a look at it. But there's more news also on myjoyonline.com. My name is Gifty Andopia. And don't forget, especially when you're no longer alone in a room, to make sure you must come. My name is Gifty Andopia. I'd love to see you again tomorrow. Do take care.